All right, guys. Just pulled up. Hope you guys are having a good parts of the week. Here tonight is lesson 3 of the remote therapeutic monitoring course. So you're going to pick up just a review for today. Summary of today's lesson is we'll start off with the homework of the case study that we've been continuing on, and then we'll get into understanding software requirements for RTM. We'll go over the RTM software checklist and some software comparisons. And then we have a number of case studies. We'll see how much time we have left to go through some case studies as well, just to help cement just this information for you. So again, this is the cheat sheet that we've been utilizing, and especially for the case studies. Just in review, this has really just the main points for where people get stumped. It doesn't have all the details, but the main points. So 98975, the initial setup. Again, so 1 time per episode after 16 days of monitoring or data transmission. 7.6 and 7.7 are for the 30-day rental supply after the 16 days of monitoring over a 30-day period. 98980 is the first time-based code, and this should also have an interactive communication piece with during those 20 minutes. And then 98981 is the second set of 20 minutes, which is multiple per calendar, which also has interactive communication. All right, so picking up where we left off, this is the case study. So we start off after class lesson 1, talking about this individual's first month of RTM. So now this is the individual's second month of treatment. And so that's where we picked up. So his evaluation was on 3/1/22. And so now we're picking up into April, if you will. So the accumulated time and dates we can see here in April, April 3rd, 7th, 14th, 18th, 22nd, and 28th. And we'll, again, just for simplicity, we'll assume that there was an interactive communication that happened at some course. Probably 3/4 of these dates were actually scheduled visits. So where we were talking to him in the clinic. The data transmission through the software and monitoring each day from April 1st through April 30th. So what that's saying is that we got 30 days of data transmission / monitoring. So the question is, what are we able to bill for this month of April? So go ahead, if you guys can put into the chat what codes you would be able to bill for the month of April for this individual. Right, so I see some answers coming through. Looking good, guys. All right, anybody else want to chime in or disagree or agree? All right, so we're going to go on into the answer. If you're watching the recording, you're not ready yet, then hit pause. All right, so yes, we had 35 minutes of accumulated time, RTM minutes. So that means, and then we also dissatisfied the 30-day rental supply device, which is 98977. So we were able to bill both those codes. Someone commented that we were 5 minutes short of 98981, which is correct. And then 98975 is the initial setup and education. So we were able to bill that during the first month, but if for some reason you missed it, you didn't bill for it, then yes, you could bill for it this month. But again, the 98975 is just a one-time code that you're able to utilize per episode of care, kind of like the initial eval. You wouldn't bill another initial eval during the same episode of care that you're treating. So, all right, good job, guys. So we'll kind of skip through this. This is we've covered this extensively in the last lessons as far as the more comprehensive breakdown of the code. So if you need to review that, look at back at the recordings of the previous two. All right, so getting into software. So probably the question of, and I got it, just somebody else texted me today or messaged me today of, the question is, so what software do you recommend for RTM? So that's probably one of the most common questions I get concerning that question. And kind of diving into it a little bit more, I think why it can be difficult to pick one. And I might have referenced this earlier in one of the other lessons, but it's kind of like driving a car. That's picking out a car if you've never driven one or never even ridden in one. And that's a lot of us, as you're looking to start RTM, you've never done it before, you've never done it at a previous job, you just have, again, it's your first time experience doing it. And so here you're tasked with picking a software when you're not really sure what it's supposed to do or what its capacity is, or just even how RTM works. It just makes it that much more difficult, even more so than probably an EMR, where most people have had a few jobs or have been exposed to a few different EMRs, and you kind of know what you like and what you don't. Our team is a little bit different, again, because this is, again, most people's first go around at it. So that can make it a little bit more difficult, and I think why I get asked that question is probably one, if not the top question I get asked. And some of the caveats around it is, does this software, does this count as an RTM type software? So to answer that question, so the FDA, if we're talking technically, is each software should meet the definition as proposed by the FDA. And so again, this gets into more legal jargon. But we'll just explain it for what it says as far as in the document. But per section 219H of the FDA, a device is an instrument, an apparatus, an implement, machine, contrivance, implant in vitro region, or other similar related article, including a component part or accessory, which is recognized in the official national formulary or the U.S. Pharmacopoeia or any supplement to them. So guys, I'm not really sure exactly what that means, but hopefully, again, we don't have to understand it all, but there's more to it. So number 2 is intended for the use of diagnosis of disease or other conditions in the cure, mitigation, treatment, or prevention of disease in man or other animals. Or number 3, intended to affect the structure of any function of the body of man or other animals, and which does not achieve its primary intended purposes through chemical action within or on the body of man or other animals, and which does not achieve its primary intended purposes through chemical action within or on the body of a man or other animals, and which is not dependent upon being metabolized for the achievement of its primary intended purposes. The term device does not include software functions excluded pursuant to section 520. So again, I can't really make much sense of that. And I would imagine that it would take just a high level attorney to really decipher all these terms. So the FDA considers software intended to be used for one or more medical purposes that perform these purposes without being part of a hardware medical device to be software as a medical device. The FDA considers mobile medical applications or mobile app as a software application that can be executed on a mobile platform or a web-based software application that is tailored to a mobile platform, but is executed on a server. So that last sentence makes the most sense to me out of all this so far. It's like, okay, I can identify with a mobile app and a software executed on a mobile platform, web-based, And then the last sentence here, the software is medical device defined by the International Medical Device Regulatory Forum as software intended to be used for one or more medical purposes that perform these purposes without being part of a hardware medical device. So the overall, and this is what I was taught by someone who's much more knowledgeable, Rick Gawanda. He was, talking to this. What he basically said, he couldn't tell somebody if the software passes this definition or meets this level of a definition. And if he can't tell somebody, then I can't tell somebody. But ultimately, if you were doing your due diligence, then you want to ask the software company themselves one is, does your software meet the definition provided by the FDA? And they should have some sort of attorney legal document that the attorney is determining that their software does comply with this definition that I just read to you, right? But I don't see any of us being able to make that determination. But that it would be the technical answer of like, does it meet that definition? Again, if you're not sure, you could contact your own attorney. There's a lot of software companies, coming out, and people ask me, I think there are some very basic kind of pieces to it. Some people have asked me like, can I use the software that I forgot the certain ones basically the question is if they don't have internet, or if I can't see like their adherence, can I still use this kind of software, and can it count as remote therapeutic monitoring? And if there's no ability for you to monitor remotely their adherence, then at least I don't see, and again, this is my opinion, I don't see how that can suffice as a software device that is providing remote therapeutic monitoring just by the simplistic definition of the term itself. In a layman's application of remote therapeutic monitoring, it needs to have the ability to do some parts of that. But again, if it's a new company that you're talking with, or a startup, then you can ask to have their legal document that shows it meets the definition supplied by the FDA. Won't technically be an approved software, and that's kind of the other piece too. There's no software that is technically approved. It's just a legal opinion that it meets the definition of supplied by the FDA. So when we're getting to software, so I've changed the way that I've delivered this after the first cohort, and part of it is I recognize that because RTM is there's so much new coming out, and it's such a new thing, that there's a lot of new software, and even the software companies themselves. If I had done some consult demo with a company a few months ago, and I was presenting on that information that they provided me a few months ago, it could be completely out of date because they've changed their processes, they've updated their RTM, they're doing a different kind of billing option. So what I realized is I couldn't educate my students on the specifics of each program. Instead, the best thing I could do is let you guys know what certain features are available and the perks and benefits of each feature, so that then you can use this checklist when you're doing your own demo, and you know how to ask the right questions to the person who's doing it, so that you can then make the decision for yourself which software is going to meet your needs. And at the end of the day, people are going to choose different software because you have different needs from each other. And so the best software for you is going to be different from somebody else. So without further ado, so again, this document is in the resource guide that you guys have available to you. So, so I'm going to go through this checklist here. The first one here is, I find it really helpful, is to have an RTM software that integrates with your EMR. Again, does it have to? It doesn't have to, but it just simplifies the whole task. And what I find is with something new, if you can simplify it, then there's going to be better adherence for staff. Same thing with patients. Just the more simple it is, the more compliant and the greater success you're going to have. If it's complicated or if there's too many extra steps, then it's hard to get it implemented. So, so we use Jane, and so this is showing me as a patient. And you can see here in Jane's platform, I have a link here to PhysiTrack, which is their main HEP program that really integrates. It's the main one that utilize. So I've been using PhysiTrack for 4 years or so, as long as I've had Jane. And I kind of just back end into using PhysiTrack for RTM because I realized as we were getting started that they had a capacity to provide RTM services. So it was just a simple thing. We're already using it. It does not have some features that other ones have. But for the sake, for us, at least at this point, it just makes sense for us just to stick with it because it's doing it. We know how to use it. It's less to learn. And when we're already starting to, having to really learn RTM, we didn't want to have to also learn a whole new exercise program. We could have if we needed to. It would have been worth it. But again, it just simplified it for us to start. But what makes it easily integrated is if I'm starting with a new patient, again, if you have a different EMR, it probably works some things similar. I'm able just to click of a button, pull up their program, and then one click, I'm tied to their program. And so it's just very simple. I don't have to update. I don't have to type in a patient email and phone number and name and create another account for them. It's really just simply a click of the button, and they have an account set up in PhysiTrack. So again, I'm not necessarily, I'm not promoting saying that PhysiTrack is the one that people should use. I'm just showing like the simplicity of the ease that other platforms can do something similar. But again, just it takes away some of the burden of getting going when you're able to do that. So the other thing too, when it integrates, and I did mention this earlier too, and I full disclosure, I have to figure out how so this is an article by PhysiTrack. They were talking about documentation and if it does not integrate versus if it does integrate. So you could use PhysiTrack and not have the integration with your EMR and still use it, right? But there's some extra steps that they're talking about that you need to do to align the program with your EMR and your medical record. And so they're talking about how you can make a copy and download the reports and then upload them right into your EMR, where PhysiTrack has the capacity. And I can show you. So here is like when I do a program, it'll just automatically put it into their chart. The piece that I have to figure out a little bit more with PhysiTrack is it just shows me their exercises. So I have to figure out how it actually shows me their adherence reports. Probably sometimes I just have to kind of realizing I don't get that full remote monitoring report into the EMR. But it has that capacity to do that, which again just makes it very simple. So if there was an audit, then you want to make sure that there is data to support. And if it's in the EMR, it's just one step closer. Does it technically have to be in the EMR if there was an audit? I'm not sure about that. I would think that as long as you have access to that and you can support it and that you would be okay. I've never been in an audit. I don't know if there's anybody that's ever, maybe there's somebody that's been audited about RTM, but again, it's a relatively, it's a really new, thing, right? So there's some unknowns about that. Is if you had records in your software, that kept the records of it that you could access, 3 years after the fact because of an audit, then would you be good? Possibly. You'd be safer if you had it in your EMR. That's all I can say in regards to that. So integration then just makes it just another step easier. So we covered that. If not, how easy is it to get the PDF into your the PDF of the HEP adherence into the patient chart? All right, so the next one is a timer to start stop when you're delivering RTM. So this this kind of goes back is ultimately you have to keep track of your time, right? And have a system where you're keeping track of the minutes, whether you're talking with patients, before your appointment starts, you're, doing some RTM, or at the end or the middle of an appointment, you're doing some RTM minutes, or you're on a phone call, or you're remotely monitoring them. You have to have a way that you are keeping track of the minutes, and you really need to make sure that you devote like one platform to logging those minutes. And PhysiTrack does not have that feature, right? So we have to keep track of it in another way, and we developed a system around that. But a lot of them do, but you can't just halfway use the timer, because then the time doesn't actually reflect the full amount of time that you've used. So you kind of have to either be all in or not. So let's say the HEP has a timer. So that means when you're talking with a patient, you pull up their program. So it would look like something like this. I would pull up their program, and then as I'm talking, there'd be a button right here. I'd hit the button, and it starts accumulating the time. And then, we get through the discussion. And then once the discussion about their HEP is finished, I'm hitting the stop. And then maybe at the end of the session, I'm pulling up their program, I'm adding an exercise, I'm switching the order. But while I'm doing this, I've also hit the start button here somewhere in the program. I'm adjusting it, to those things, and then I've stopped. So, and so it keeps track of that time. Now, there'll be some time that you're maybe not in the program. Let's say you're on a phone call and you're talking about their program. So what you also need to have, and I have that right here, is the ability to do a manual log, right? Because that you could insert it into the software minutes that maybe you accrue, maybe you just forgot to, count the time using the timer. So you need to manual log those minutes. All right, let's see, there's a question here. I've been using the timer on my phone anytime I do any RTM. Yep. So, well, and yes, if you have a timer on your phone, but then you have to just make sure, like, what do you do if you switch to another patient, right? So if, and you can definitely do that, Michelle. You just have to have your own system like for it. So let's say you use a timer on your phone, and then you zero it out the next time, when a new patient comes in, then, and then you look to see how much time that is, great. I think a lot of people, like, for, again, this is kind of how we typically do it, is at the end of the session, we don't necessarily time everything that I do. I don't time to the second how much manual therapy I do, or how much Therax or Theract, but I know I've spent 60 minutes with that patient, and so I just divvy out the minutes. So I did about 25 minutes of manual, 15 minutes of Therax, 10 minutes of Theract, and I had 3 minutes left over of RTM, right? So it's a little bit of a an estimation. I think that's what a lot of therapists do when they're picking out the units for the charges for a session. So let's see, Michelle, I'm all mobile, so only with one patient at a time. All right. Yeah, perfect. So if you got, if it's working for you, if you got a system works for you, that's what you need. You just need a system that works for you. If you're happy with it, then great. Let's get here. So the next point is, so a patient monthly 30-day adherence summary report that can be easily downloaded into the EMR. So again, PhysiTrack, again, they do not have this, right? So we do have to do a little bit more. So this is the adherence. And so a lot of them will show like over a 30-day period of when they started. It could be mid-month, but to hit that 98977 for the rental supplies, you have to have 16 days within that 30-day period. So a lot of them will keep track of that. And so you can see this adherence summary report, and to know kind of where they are and who have met that. So the one question that I would ask an RTM software company is, if they are calculating adherence, then they are also have some definition of what it means for data transmission and or monitoring, like what counts as one of the 16 days of data transmission or monitoring. So if they are calculating that for you, you need to make sure that their definition is something that you agree with, as far as understanding of, the coding. So that would just, again, be a question to ask if they're calculating that time for you. So a communication log, so that denotes date, time of the participant, can be downloaded into the EMR. So again, going to PhysiTrack. So the communication log would be your, HIPAA compliant texting, messaging system. So this is showing how it looks in PhysiTrack. So again, the nice thing about this is, what we do is when we're remotely monitoring is I'll put minutes associated with it, but also do, some sort of comment on here so that we get a time. We can see once I submit that there's a time and a date stamp. And so if there again was an audit and I can download this report, download the messages, goes in their chart. So it shows proof that I was actually on this day. And, I have to calculate the time it spent, but at least there's proof that yes, we were on this day. There was a message sent at this time as I was remotely monitoring. So again, this software should have some sort of communication log. It's again, nice feature just to make sure you can denote the time and date, and it's a helpful feature just to improve just that communication with the patients. So the EMR, so we talked about this, easily integrated already. This point right here, data submission monitoring tracker. Ideally, the software counts the days within a 30-day period, and also when you reach the 16-day to charge 98975. So some will, once you hit that 16 days, they may let you know the earliest time that you could charge for the initial value, the 98975, which is the initial setup and education. A lot of them will have some sort of tracker that will tell you once you've satisfied those requirements. So the billing notification indicates the CPT codes, the requirements when they have been met. But again, you need to make sure the requirements that you guys agree upon, the definition and the interpretation of what those requirements are. And then some sort of monthly billing report for the clinic. I do find, and this is what we do, it's easier for us is just to wait till the end of the month to calculate all our RTM codes. And I think that's what a lot of people will end up doing. Do you have to do it that way? No. Could you send, bills sooner? Yes, you could. But again, we try to just, for the sake of simplicity and kind of doing all instead of kind of doing a little bit of here, a little bit of there, we just find it easier just to have one time a month to do that. So having a monthly billing report would coincide with that billing strategy. So a missing time priority list. Organized where you can see what cases are closest to achieving. So some of the software, they'll highlight the individuals, the high priority individuals. So maybe they'll show somebody who, this kind of goes hand in hand with this next point, an engagement notification. So if somebody's behind pace or below pace of achieving the 16-day criteria, then they'll notify you, they'll do some sort of alert that these patients are on pace and these other ones are behind pace, so that you can intervene as necessary to improve engagement or to capitalize on time, so that at the end of the billing period, you're not a day or two short of the data transmission or a minute or two short. So then on and off RTM function to indicate who's participating. Some people you'll be using the HEP, you're going to be using the HEP for everybody, more than likely. But some people maybe, again, just don't have internet access, or just say they just want to do the paper sheets. If they're just doing the paper sheets and they're not participating, then we can't remotely monitor them. And so you'd want to turn off that function for them, or make sure you're not being charged for a patient who you're not using that with. And then all this I've gone over so far is clinic centric, things that we're looking for. A huge piece of it is understanding the patient friendly interface, right? How simple is it for them to use? because that's going to affect adherence. If it's complicated, if they have to click multiple things, if there's option, like just the more things they have to do to satisfy that engagement or complete an exercise, multiple steps, it's going to reduce their compliance, just because they'll get more frustrated, right? So with any interface, some clients are just going to need more help to educate, but it should be patient friendly. So these are some things that I put down here to consider. Is can you email or text text the HEV program to them so that they can then just download the app from that message, that email, or the text. So the patient results page. So PhysiTrack is nice. I can show them their results, but they also have a spot on their side that shows them their adherence and how well they're doing as far as participating there in the app. Just again, a nice feature. I probably can't stress enough how simple is it for them to complete an exercise, or just to input some data, right? We have to have some data. It may not necessarily be a completion of exercise. It could be that they just they give a pain rating for the day. It's some sort of data delivered remotely that could count as one of those 16 days. We need some sort of data. The other feature that is nice to ask about is, sometimes patients will they'll get through a weekend and they'll do their exercises. They'll just, maybe they don't need to see the video anymore, and so they just memorize it, and then they'll just do their exercises. And then you look over the weekend and you ask them, like, hey, it looks like you didn't do your exercises. Did you actually do them or just forget to complete them? 9 times out of 10, they'll say, oh, yeah, I just forgot to go back and complete them. So having the ability for them to backdate. So for instance, PhysiTrack, they let you backdate up to a week. So there is a cutoff there, but they at least let you backdate so that you can complete those exercises. I think it would be very difficult if there was no option for backdating. It would definitely reduce your adherence and compliance, especially getting started. A lot of patients, just need that extra help. So they may get, 4 or 5 days and they're doing their exercises, and I'm having to, pull up their phone and practically do it for them and show them how they can backdate it. It's like, did you get these exercises in? It's like, okay, let me show you how you can do it. And I go off and, check off at least one exercise. So I mentioned about the pain rating. It's not the comments within each exercise option. So that's kind of what I'm showing here. Is these are comments, but oftentimes they'll have something like this where so this was a common option about the exercise. So someone might say, I was unable to complete because this one was painful, right? So that's helpful information, because then we can pull that up. We can see that they've messaged us, remotely, or when they come in for the session, we can, pull it up and we can ask them about it. So I see that the bridge, you like this one, or I see the bridge, this example, this one hurts. So the lower trunk rotation. So you're having some pain with this one. Did you keep doing it? Do we need to find a simpler exercise? Maybe, we picked the wrong one. So again, that's just a nice feature. Not that you have to have that, but again, features that are available. And then the communication messaging, I've gone over mobile and desktop friendly. Some people will just have a laptop, and so make sure that they have a friendly version of the laptop desktop as well. And then some will gamify it, turn it into, they get rewards and they get kind of stars that go off the page, and they'll say you got a streak going, great job, 10 in a row, and they'll try to just encourage them through some sort of gamification of the software. And is it required? No. Is it a nice little feature? Yes. You'll probably have to pay a little bit more for it, probably. But again, just to know that those are some options that can help improve adherence. And here what I have here is, ask the RTM software company. One, how does the software define and count the 16 days of monitoring data transmission? Again, I've talked with many of them, and I found across the board there's different interpretations of that. Some are more conservative, some are more liberal in how they define that. You want to make sure that you agree on that. So that's kind of a big statement right there. So with that being said, this is a checklist that I would, for you, is just make sure you're well informed about these features. You're going to prioritize the ones, maybe differently than somebody else, but know that these are available. And so when you go to pick out your software, you can ask them more specifically, do you have this feature? Do you have this? Especially if they're ones that you're really looking for in a program. The other thing too, let me, so I'm going to get into some of the specifics of some of the programs. And I will say the billing for the software is very different as well, as far as, and many of them have changed. They've adapted. I think MedBridge, starting over the summer, they were issuing out, like, I forgot what they called them, like some sort of patient credit. And each month you had to purchase so many credits as you started, and they were some certain amount that had a significant cost to having to purchase a certain minimum number. And I think they scratched that whole system because it was kind of was confusing. It was confusing. It sounded expensive. I think it probably was. So I don't know what their system is now, but just recognize there's a lot of different ways that the software companies will charge you for their services. And there are some very economical ones. And the ones that have extra features that, again, if that can be nice if you are looking for that just come with a cost as well. Not that it's right or wrong, it's just kind of the nature of it, right? So the bare bones, one is so PhysiTrack. Like I've already shown you, this is what we use. It is bare bones. It is inexpensive. If somebody's asking me like, hey, like I'm concerned about the cost, I'm like, it does not have to cost a lot of money. Just in the same way you could use Google, the Google Docs, for EMR. I've kind of seen, people do that, that have, it's all integrated or some sort of automation and, piece like that. And it hardly costs anything. There are options, kind of the bare bones. PhysiTrack is kind of like if you're using, Google Docs for EMR, right? So it satisfies the requirement. It covers all the bare bones. There's some extra systems that you have to develop around it to make it work. And so that's what we've done. And the positive side is it forces us to get in the program more. And the more we're in the program, the more we're accumulating RTM minutes. So that's kind of a positive side. And this is trying to update this. This is over the summer where they were saying they're finalizing on the RTM. They're fully going with RTM now. So disregard that last paragraph. But you've kind of seen me demonstrate it. They have a telehealth option. So RTM is not that it's coming soon, it's available now. They have a telehealth option as well with feature. I'm gonna delete that. So again, very bare bones, but very economical. They charge you no additional fee for, you can, bill out thousands of dollars of RTM and your fee is the same, regardless of if you're using RTM or not. All right. So I've already gone over PhysiTrack. Again, it's cheap, covers all the foundations. And then this con is actually second. So they have, I'll say that's a con anymore, that they have updated their program so that they're saying that they offer RTM now, more than coming soon. So MedBridge is probably one of just the most popular HEP programs, right? And so they have an RTM feature as well. again, this price, and this was, again, this may have changed, but they have different tiers, because they offer the CEU, right? So if you like their CEU courses, it can be economical that way. They have the HEP. You have to be at a certain tier to have the HEP, and I believe that is the premium level. That if you're at the tier below that, it doesn't include the HEP. I think it just includes the CEU. So the level that with the HEP, I believe, is what is also offered with RTM. So at the time, they didn't have a timer, and that you had to purchase each patient $10 a month. Again, I believe they've changed their system now. And then they did have an enterprise plan for a group. Again, CEU was a certain price, and then when you add the HEP, it was an additional fee, and then a small additional compliance fee. But they also did have, I believe they completely revamped how they charge you for the RTM, but there is an additional charge for kind of utilization of RTM. So Limber is a company. They provide a very different type of RTM service. And they call themselves the white glove RTM service, and I'll explain why. This is Limber. It's a digital home exercise and remote monitoring platform for musculoskeletal conditions. They have, it looks like a really nice system. They are also working on some sort of like digital form correction where it uses AI to assist with that. I think this is showing it here. Building market leading 3D camera motion capture. So they're doing some really advanced stuff, with their program. The digital home exercise program. This is more talking about just their HEP program, right? But then they have the RTM side of it, which this is an example of their monthly billing report. Again, it may look a little bit different now, but this would be an example of one that's doing it for you, right? Where we've created our own version of this using Google Sheets, since PhysiTrack doesn't have it. But you got the minutes, the days of transmission, and they're telling you what you're able to bill for that month. So let me explain. There's a lot on here. I'm gonna just explain this, so don't kind of read through this. Let me just explain what this says. Is they have changed their system where if you're enrolled in their RTM, they basically do it for you. And what that means is you've outsourced the monitoring of RTM to Limber, and they have a trained therapist. I think they call them this down at the very bottom, the care navigators, remote care navigators. So it's a trained therapist who is part of your team in essence, right? So their responsibility is delivering RTM. So they're checking in, they're getting all the minutes for you. And at the end of the day, there's some communication with the staff. They're not advanced, they're not changing programs or, making clinical decisions as far as on exercises, but they're trained in kind of helping to encourage patients. I forgot, that sounds very basic, but they have some level of like engagement training, right? Motivational training, something like in that regards, that helps them to keep patients engaged and doing their exercises. So this feature, ultimately, if you decided that you just didn't want to do it, didn't want to like diminish yourself, it was too complicated, then you could still make money off of RTM. Ultimately, they charge a substantial fee, but you only pretty much, it would be hard to lose money with Limber. You could definitely probably figure out a way to do it. But if you had at least a certain number of clients participating, that you're paying for the time that the therapist is accumulating minutes. So the more minutes they're getting, the more that you can charge for. But a significant portion of that goes to the Limber who's providing the service. But there is some left over for you to actually add to the bottom line. So again, it's a white glove. They're doing it for you. They're probably the one that stands apart as far as really offering a unique, a different kind of type of RTM is Limber. So pros, it's a white glove, done for you RTM, built by the leaders, helping to shape RTM. They have the timer, record keeping, billing, monthly report, only charged when you make money. And they have that motion guided feedback, feature that they're developing. So, and there's a high price. You're giving a big cut of the RTM back to Limber, but for the most part, there should be some left over for you as well. So PT Wired. So I would say where they stand different is they really focused on the gamification, and they created an app where you put your own branding and logo on it. So they make it look like you have your own app, right? So the whole platform is branded with your clinic. So it's unique in that way. There is kind of some startup cost of just doing that all with them. But they really try to have some other features such as push notifications, and where you can use the app to make announcements. Like let's say you got a workshop coming up and you have it run on it, that you can do some push notification because they have that on the app through it, just like you would if you have the Chick-fil-A app and you see that they're having 4 times bonus points, and you get that notification on your phone. In essence, you'd be able to do the same thing through the PT Wired app for other aspects of your clinic. So I wouldn't say that they focus that our team is a piece of it, right? But if you really wanted just a feature, a software company that has a lot of scheduling function, they're really thinking more broad, if you will, of how they can provide services to help in other areas for a clinic as well. They even have the Google review capture, again, so they're trying to think of how can we get more Google reviews, how can we improve scheduling, improve showing up on time, announcements, all that kind of stuff. All right, so Karina, she said that they use PT Wired and really likes it. So feel free, Karina, too, since you use it too. If you have anything else to add from what I've said, you know more about it than I do. So if you have anything else to say, feel free to chime in. Yeah.
The PT Wired app has been awesome. They have a dashboard that helps you monitor where your patients are in the process. They have that automatic timer. So sometimes if I have 20 minutes of free time, I'll just sit down, turn on that timer, and go through different patients, and it automatically calculates minutes based on and attaches it to the different patients that I'm looking at the time.
Yeah.
The way that they charge for the RTM is they charge you a small fee for each code that you bill, and then
percentage.
Like a percentage. Yeah. $5 or $10. But then if you don't end up collecting on those codes, then they give you the money back. Okay. So it's kind of like a no risk situation. And they've also just added, because one of the issues that's, like you've discussed, is sometimes it's difficult to get patients to actually click that they've done the exercises, and that's the only way that it tracks it for you. They create a great report that you can just copy and paste into your your EMR.
Yeah.
But they've just added a feature where patients can track their steps, and it will pull in the data from whatever step tracking that they're already using on their watch or on their iPhone. It'll automatically put that in and calculate that as one of the data points.
Yeah. So again, it has definitely extra features. Now, a lot of them too will do some sort of fee per. I feel like a lot of them have fallen on hey, if you're charging this, we don't collect unless you're unless you reach these levels, and then we charge you a certain fee or percentage of the collections. So I find that a lot of them are going with that type of method, like PT Wire. So thanks, Karina. So yeah, so we already went through PT Wired. Again, this pricing might be off, so meant to update this. I think at the time they charged 10% for each bill code, but it may be different. There is some sort of a setup fee, associated with it. So AC Health. So this is a new company that reached out to me. I'm gonna just pull over their screen. I'm set up to do a demo with them soon. It is that as far as the pricing, it's I would say it's another kind of PhysiTrack type of pricing that they've explained, where and it's like, it's very inexpensive, right? What do you get with that? I'm not quite sure yet. But is it more than PhysiTrack? I'm not sure. If you were, more of looking, just to, just really save on cost and, want something just, low, just very low getting started, or just to settle on, I would consider AC Health. Like I said, I don't know too much about their platform here. They're talking about RTM. I don't think they charge you any additional thing like PhysiTrack for collections. Let's see. I think that's what they say here. Track your actions. Honestly, it could be better to PhysiTrack with some of the things I'm seeing here. Generate reports, to submit claims and receive reimbursement. Some sort of integration with the CMS 1500. And from what the owner who developed this reached out to me, I'm pretty sure they don't charge, no extra fees for utilization of RTM. So it's just included in the subscription. So that's how PhysiTrack is with that. So considering something like PhysiTrack, I would at least reach out to AC Health just to compare the two. And then the other one is Wheel. I'm not sure if I'm pronouncing that right. So I'm not sure if they're up and running. I had talked with their owners too. So they're probably more in the line of PT Wired or MedBridge, as far as like what they're really trying to do is do more than just kind of bare bones. And again, I'm not sure if they're up and running yet. I think they should be really soon. But that's one other one that you could check out and do, again, a demo with and compare. So other ones too, HealthView X. Again, I don't know much about them, but they have something. I've had a student that used PhysiTech. It sounds like PhysiTrack, but it is a different RTM. So again, there's a lot out there. Like every month or two, somebody else tells me about a new one, or somebody like one of the companies reach out to me because they've find what I'm doing and ask me if I could do a demo or do some sort of call with them. So there'll probably be more in the market that comes. So again, if you know what you're looking for, that helps to make a good decision with that. So guys, we got what I may do is we got a few case studies, and we're kind of right here at the end of our time. So before we do that, we may just save the rest of the case studies for lesson 4, because we got plenty of time for lesson 4 to do that. So any other questions? So Debbie said she'll be going with PhysiTech. So Debbie, what do you like about PhysiTech? Like I said, I don't know too much about them, but it would be interesting what you know about them.
Well, first I wanted to say, when I talked to AC Health, it was an extra charge for the RTM on top of the home exercise program.
Okay.
So they were $150 a month for the RTM plus a $300 app development fee. So their pricing was a little bit more like PT Wired.
How long did you talk? How long was that you talked to them?
I looked it up in October.
Okay, they may have, again, it may have changed. I'm not sure, just with what I pulled up on the page, and even the owner who I talked to, she made it sound like there was no additional fee for it. So again, I'm not sure if that's been updated or changed or exactly what.
Okay. I'm just looking at my notes.
Yeah. So, but I think the fact of the matter, is like a lot of these companies are trying to figure out how to make it work. And so things can get outdated pretty quick with like what they think they're going to do. And then they realize that they need to adapt because of the market is telling them something else. And to be competitive, they maybe, have to do something a little different. But yeah, tell us a little bit about Physiotech.
Physiotech
Physiotech.
was, physiotech.ca. They're actually not based in United States. I can't remember where they're based out of, but it was very basic. So it didn't cost all that much. It's just a home exercise program and just the RTM.
Yeah.
Well, it's just a home exercise program. You can add on the RTM if you wanted to.
Okay.
But because it's just me, I'm just mobile. I've got like 10 patients, current at a time. I didn't want to spend all that money.
Yeah.
And so it's relatively inexpensive compared to many of the others.
Yeah.
And they were going to offer me a discount to give it a try. And so it just seems it doesn't have all the bells and whistles, but I didn't feel like I needed all the bells and whistles. So I felt like it was a good place to start.
Yeah, I think that's a great example. Karina, I know she has a larger clinic, with a number of employees, right? And so sometimes the pricing, favor like, for a one-time setup or a monthly, fee, when you have so many users, it ends up not being like that much, right? But for somebody like Debbie, who's just a solo practitioner having, 10 clients, like if there's this monthly initial, fee or setup, for her, again, it just doesn't make, sense, just financial sense. So, I think you just have to take that into consideration of where you're at, where you may be. The other thing is I would consider you to, what you don't want to do is like the headache of changing an EMR system. Like it would be like, again, you could do it if you need to, but it's a lot of work, especially if you have like more people that are doing it, just to learn a new system. So in some ways you don't want to have to change an HEP program when patients are already using it and you're using it. So if you are growing, maybe the one that you go with is one that you can grow into. If you just want to, stay a single practitioner, then maybe just and develop those own systems that you understand, but you don't have to teach anybody else. And that can really work, and you pocket all the money, the extra money that you would have paid at a software company, right? But you're fine doing it because you're small and you understand it, right? So yeah, any others that other people have looked at? Now we got a few other people here on the call, or ones maybe I haven't mentioned. There's probably ones out there that I don't know much about. Thanks, Debbie, for sharing that link. To their page. Okay. All right, guys. So we'll pick up with on Thursday will be the final class. We've really gone over the like 90%. I mean, all the main information that you need, we've gone over, right? We're going to go over some as far as staff, how, like if you have staff, the ways that I've found to best educate staff, and because part of it is getting their participation in it as well. So we'll be going over that. We'll be part of next time, but then we got a number of case studies that we'll go through, and some that are pretty easy. So I got 5 on here that, again, we didn't get time today, but that's okay. We got plenty of time on Thursday. And we'll go through probably 10-15 minutes of staff engagement if you have staff, and then we'll go over just some more simple case studies, but then get into a little bit more tricky case studies. I'll see if I can catch you guys sleeping with some more tricky case studies. So a few other questions just to consider is bookkeeping and accounting. We had to add, we use QuickBooks for accounting, but something to talk with your bookkeeper. We had to add a new revenue line for RTM just to help keep track of that. So whoever does your books, just make sure that it's just nice when you can track that for record keeping. So ask them about that for invoicing or record keeping. All right. Oh, and yeah, the last thing too, I got you, is, one favor asked too is I'll probably be offering this course maybe early summer. I'll probably do it maybe 3 times this year, or maybe 2 or 3 more times this year. But the main way people end up coming on the course is on the Facebook group. Probably most of you guys on the Medicare, Anthony Maritato's Medicare. So I'll post like once a month about some of our things and do some free training, some webinars, and then, offer the course. But yeah, if you see me do that, I'd love like just to chime in, like if you've had value from the course and really, if you benefited from it, then that can really help for other therapists that aren't quite sure. If you just make a comment on the Facebook page, if you see it, just make a comment. Again, that would really help to encourage others who are on the fence, or I'd love to get them going with RTM. And I think a lot of people just need a little extra support. So if you don't mind making a comment when you see something like that, that you were, a student, and just how I would appreciate it. So over a few of the next class, like I said, we'll be going over, actually they had some proposed rule changes. We'll talk about what those proposed rule changes were, just briefly, because I think it's helpful to understand if there are changes ever made, at least what was considered. The rules were shot down, so thankfully they didn't go into they weren't enacted for us. So but it's again good to know. And then the homework is start scheduling some demos. So you have everything that you need to know, and the biggest kind of halt to getting started is not having a software company that you can use. So I would encourage you guys to reach out to these websites of the ones that we've mentioned, and to start scheduling some demos, the ones that you're interested in, so that you can have a software and start going. The students who are able to just take this course and implement, and again, removing that barrier of not having the software is going to prevent you from doing it. And the sooner you do it, as far as timing with taking the course, the more successful you are at utilizing the information that we've gone over. So I'd love to by Thursday, if you gone, I'll ask people if anybody's schedule some demos, especially if you don't have an RTM software. And I'll send out the email with the replays. It'll be all 3 replays of lesson 1, 2, and 3, and the resource guide as well. So keep on the lookout for that. And I think that is all we got, guys. So thank you guys for tuning in live. It's always great having students that are on live. If you catch on the recording, I'm glad you're listening to the recording too. So I'll see you guys back in 2 days on Thursday. So thanks again.